I think this will resonate. I'd love to hear your point of view about this. It's come up a lot in my conversation with chief data officers, this idea of, the 4 Vs, more data of more kinds in more places. So when you look at what you've been able to do from an analytics lens, refracted through driving better patient outcomes, how important is that external data sourcing and sourcing data from a variety of places to driving those outcomes? And how much is kind of agent-based versus traditional replication, and an important capability to drive those kind of outcomes for you and your team?
Before I answer that real quick on the agent-based, what is, when you say that, what do you mean when you say that?
So this is kind of my non-technical shorthand. So, at least as I think about it, in traditional EDW or in sort of modern data lake, mostly what you're doing is you're like, well, all I want to do is get the data in one place, and then I want to have some kind of standards, or I want to have a semantic layer, or I want to have fuzzy matching, and I'm gonna bring all that together. So what has come up, and this has been a pretty consistent theme, I want to say over a dozen or so CDO, CIO interviews, is that there's a lot of interest in not replicating the data, but querying it in place, almost like the modern version of an old-fashioned RFC, so that you're not replicating all that data, you're not introducing integration volumes, you're not introducing a new failure point, but you're getting sort of the kernels of that data based on some tiering of data to drive the desired outcomes or the desired analytics models.
Yeah, it's almost like the virtual data warehouse approach to doing things.
Yeah, exactly.
Yeah. So let's kind of answer your first question. So, healthcare is unique. Like we say we're unique, but I will say when it comes to data, we really are. So when I came from Expedia, we were dealing with multi-petabytes. Like that was just pretty, and we weren't even big, right? So I come into healthcare, and I look at us, and we're like 20 or 30 terabytes. Which is like a snack, right? It's like, you can do that on a laptop. But what I will say is you get into looking at clinical data, it's really, we don't have the volume problem, at least back then, but we have the variety problem, right? Where the variety of data that's out there and how you sort of have to bring it together, it's really complex. And at Seattle Children's, we had, for a lot of the clinical data, we had Cerner and we had Epic. So we had, for a lot of the revenue cycle. And so we ended up having really kind of 2 EHR vendors that we had to integrate within that environment. And so that added to the complexity. So I think healthcare has like tremendous complexity when it comes to data, unlike any other industry that's out there. And what we're seeing now within our environment is that it's the volume is starting to come into play. So it's like any organization, it's like picking a notable industry, say travel industry, like when I was at Expedia.
Yeah.
Booking data is kind of at the core of your business, right? And so the volumes are kind of big. And then in order to move up the value chain, though, you bring in the next set of data, right? Which is clickstream data, right? And then that goes way bigger, right? It doesn't just get incrementally bigger, it gets exponentially bigger. And then of course you get that going, and then you sort of layer in the next one, which would be, say, search data or social data or thinking. So healthcare is a lot like that, right? So we started out with just a lot of the core EHR data, and we dealt with that. And now we're streaming data off the bedside. So now we're not only getting data like constantly, right, off the bedside, so massive volumes, we're getting wave data. So it's not just structured data anymore. We're starting to look at genomics data. Now that's starting to come into play, and that's going to bump things up. There's some discussion around social data. And so I think, we started with the complexity problem or the variety problem, and now we're starting to see as the volume problem. And in terms of, where's the value? I've always find the value comes from the data that you have, as opposed to the data that you don't have, right? And so Amazon built a business with using only their internal data, right? They at the time, it was very common practice to work with a lot of these, third parties that do data aggregation, like Axiom, for example. And Amazon wouldn't do any of that. They said, you know what? We have more information about consumer behavior, and really the value that we get in terms of creating a customized experience comes from that behavior data. Right? What we know about our customer. And I think healthcare is the same way. I think, at the end of the day, it's what you know about your patients and families that allows you to really deliver a higher value of care. And you can actually go after it, right? There's a lot of transactional detail out there It's just learning how to use it.